The topic is myths about peripheral vascular intervention. I am Dr. N. Khanna. I am the Group Advisor for Apollo Group of Hospitals and also a Senior Consultant in Cardiology and Vascular Interventions. Now coming to peripheral vascular intervention, one has to understand peripheral vascular intervention is angioplasty or any other procedure done through a catheter without opening the body or giving a cut to treat vascular disease. Now the first myth is peripheral vascular intervention only involves the arteries and veins of the lower limb. That is not true. Any artery which is not the heart artery, diseases of every artery except the heart arteries, that means the arteries could be the main central artery which is the arterial highway of aorta, or branches, arteries going to the brain, or arteries going to the hand, or arteries going to the gut, liver, intestine, kidney, lower limbs. They all come in peripheral arterial disease. Similarly, veins of the leg, veins of the abdomen, veins of the head and neck region, they also come in peripheral venous disease. And apart from this, there could be blockages in these arteries, there could be leakage of the venous valve, there could be clotting of these vessels, or there could be abnormal connections between arteries and veins, or abnormal malformation of these arteries and veins. So all this combined actually comes in the gamut of peripheral vascular disease, and treatment of these without surgery is known as peripheral vascular intervention. So the number one myth is peripheral vascular disease involves only lower limbs, or peripheral vascular intervention only involves opening the arteries of the lower limb, and it only involves diseases like pain on walking, which we call claudication, or gangrene, or a non-healing ulcer. So that is the first myth. The second myth about peripheral vascular intervention is that this is done by cardiac vascular surgeons only. No. All over the world, 2/3 of peripheral vascular intervention is done by cardiologists, interventional cardiologists in particular, and 1/3 is done by vascular surgeons and interventional radiologists. And this is very understandable because the cardiologists deal with heart disease and they open the blood vessels with interventional techniques, and the same process of disease actually occurs in the entire body. And once the cardiologists are so good in actually dealing with blockages of the heart arteries, they, with some training, they can actually be very well trained and they can manage blockages and other clotting of the arteries elsewhere in the body. And the third myth is that peripheral vascular intervention is only important for treating gangrene or for treating claudication. It is not a life-saving procedure, it's only a limb-saving procedure. That is also not true, because doing peripheral vascular intervention in acute limb ischemia and critical limb ischemia actually involves saving lives. And it also, if you do it in carotid arteries blockage, it involves saving stroke. And in other areas in aorta and also, if you do it, it involves saving lives because of to prevent sudden rupture of the aortic aneurysm or dissection. So it is a life-saving procedure. It is sometimes much more rewarding than interventions for coronary artery disease. And what is also very important, patients who have coronary artery disease and are undergoing interventions for coronary artery disease, it is prudent that we look at peripheral vascular disease, which is associated in 60% of cases, and also do interventions for peripheral vascular disease.